Have you ever looked at your newborn's tiny belly button and wondered about that little stump? It might look unusual at first, almost like a final reminder of your baby's time in the womb. For many parents, the umbilical stump can feel a little intimidating to care for. But the truth is, with gentle attention and patience, it will heal beautifully on its own. In the first few days after birth, the stump usually turns black as it dries. It will naturally fall off anywhere between 1 and 4 weeks later. This process is completely normal, and you don't need to do anything to speed it up. Instead, your role is simply to keep it clean, dry, and protected. The best way to help the stump heal is by giving it air. Fold the top of your baby's diaper down so it doesn't rub against the area. Choose wrap-style shirts instead of onesies, or use special newborn onesies with a cutout for the cord. This way, the stump can stay dry and avoid unnecessary friction. You may have heard advice to clean the stump with alcohol, but doctors now recommend against it. Alcohol can actually irritate your baby's delicate skin and slow the healing process. Instead, stick to sponge baths until the stump naturally falls off. Remember, less is more when it comes to umbilical care. Most of the time, the stump heals without any problems, but call your pediatrician if you notice pus, swelling, redness at the base, or if the area seems painful to touch. These could be signs of infection, and it's always better to have a professional check. Trust your instincts if something doesn't look right. Reach out for guidance. Caring for the umbilical stump might feel a little stressful at first, but remember, it's a short and temporary stage of your baby's early life. With a little care and patience, your baby's belly button will soon heal completely. Think of it as one of the first lessons in how amazing the body is at taking care of itself.